I would say statistics right now are 13% of medical schools, pharmacy schools, nursing schools teach about the endocannabinoid system. Our endocannabinoid system is entwined with all of our other systems. Like, it's really important. It's just as important as our circulatory system, our digestive system, our nervous system. And basically what it is it's our body's homeostasis. So this system in our body, which a lot of healthcare professionals, again, are neglected to be taught about, is our body's homeostasis, which is when everything is in balance. So we have these receptors in our body, CB1 and CB2 receptors. So CB1 receptors are found primarily in the brain, and CB2 receptors are found primarily throughout our immune system. And when you look at a cannabis plant as a whole, the two main cannabinoids in a cannabis plant are CBD and THC. THC is the component that causes cognitive impairment, where you get the high from. So the products that I'm talking about today, the professional grade full spectrum CBD, has 0.3% or less THC in it. So there's a small amount that cannot impair you in any way, shape, or form, but it works with the other cannabinoids, and there's like 140 of them in the cannabis plant, CBD being one of them. I'll talk about CBN in a little bit, a new product that's out for sleep now. It's a cannabinoid that's focused more on sleep. But these cannabinoids all work together. All the terpenes, flavonoids in a cannabis plant all work together to give you what they call the entourage effect. And that's where it comes into play. That's the kind of, and I'll explain the difference between different products as well, like an isolate, a full spectrum, a broad spectrum, because there's a difference. And I think a lot of people don't understand that, and it's important. So these receptors in our body, if you have a small amount of THC, it's not binding, causing the cognitive impairment. The other cannabinoids are binding to the CB2 receptors in your body, thus filling these receptors and causing that homeostasis in your body. So things like anxiety, appetite and hunger control, it actually helps with digestion. I've seen people that have stomach issues, if they have like Crohn's or any kind of thing where they're having like any kind of inflammation base, because it does work as an anti-inflammatory. I'll explain that too. But anxiety, mood, temperature regulation. Some people even can use it for withdrawal symptoms. It helps with fertility. It helps balance out, pretty much putting your body in that homeostasis so that it can function properly. So how else does it work? It works as an anti-inflammatory at the cellular level, and it works as an antioxidant at the cellular level. So pretty much any disease state that we can think of comes from inflammation, right? At some place in the body, right? So again, that's why it works on so many things. A lot of autoimmune conditions that people have, because it really decreases that inflammation throughout the body. And it works as an antioxidant. A lot of people say, well, what's an antioxidant? I always like to explain it to people like it's like eating an apple. You take a bite, turns brown pretty quickly. We're constantly producing new cells in our body, and those cells can either do good things or bad things the way that we treat our body, eating, sleeping, exercising, all of the things that we do to stay healthy. Those cells can either turn into healthy cells or disease cells. So it's a really rich antioxidant to take in as a supplement, even if you're not using it for something that's an actual medical condition. And what a lot of people don't know, again, our body actually produces endogenous cannabinoids. So we have anandamide and we have 2-AG, which are things that our body will help fill these receptors naturally, but they're not anything that can cause like a therapeutic effect. So it's kind of almost like the idea of like a hug and releasing oxytocin, or that like runner's high when you get your endorphins from running. It's kind of like the same thing. Like it'll last you for a little bit, but it's not going to treat something therapeutic to that level, if that makes sense.